Two polls also show confidence is low in one group hardest hit by the virus.
All new this morning on 41 Action News today. Bryant Madrick takes a closer look at why some people are skeptical.
When a COVID-19 vaccine becomes available, would you take it? According to two polls, for many Black Americans, the answer is no. According to a Stat Harris poll from October, only 43% said they would take it. In September, a Pew Research poll reported only a third of Black Americans would get it. At Swope Health in Kansas City, Dr. Otis Latimer says trust is low among some of his patients.
Comments we get from them are, well, this hasn't been tested, and they want to use us as guinea pigs. And this is why there's such a recruitment.
Jeanette Berkeley-Patton at UMKC offered other reasons for skepticism.
The African-American community has suffered from many injustices based on research.
She says one example historically is the Tuskegee syphilis study. According to the CDC, from 1932 to 1972, the U.S. Public Health Service withheld adequate treatment from a group of poor Black men who had syphilis. The reason was to better understand the disease. Berkeley-Patton says there's plenty of modern examples also creating mistrust.
African Americans tend to have lesser access to health care, that African Americans tend to have lesser quality of care when they do seek care, and that also there can be many issues around mistrust with the medical system due to patient-provider communication that tends to be of lesser quality with African Americans as well.
As coronavirus continues to sicken and kill, especially in the Black community, Dr. Latimer is trying to convince his patients to change their minds.
I try to explain to them we have to get involved in these testing pieces from the FDA to have a good enough representation of our population to see if the vaccine is safe.
And live outside of Swope Health this morning, Dr. Latimer also has another message to people that he sees. It's a personal message. He tells me that he knows several people who have caught and died COVID-19. Lindsay Taylor, back to you.
So, Bryant, while we wait for the vaccine, doctors say there are things we can do right now that are not necessarily COVID-19 related. What are those?
Yeah, that's right. You know, while we are still in the middle of this pandemic, we're also in the middle of flu season, and doctors say it's very important that people get vaccinated for the flu. They say that's just as important as taking a vaccine for COVID when that becomes available. Putting live outside of Swope Health this morning, I'm Bryant Madrick, 41 Action News.